if we're thinking about Tiger Woods and his chance of winning this thing. And Dr. Paul Butler joins us right now. Dr. Butler, thanks for giving us time. How you doing, sir?
I'm doing great. Thanks for having me on today.
Well, thank you for giving us some time here from Des Moines Orthopedic Surgeons, Dr. Butler. All right, so we are all sitting around here wondering what is going on with Tiger Woods. We think this is miraculous. It seems like it was just over a year ago. We wondered if this guy was going to be walking again, and certainly wondering if he would ever play again. And now he's out there and has played really well through 18 holes. As a physician, what are you looking for, or what does this mean? What should all of us know about Tiger Woods' comeback?
I think remarkable is the best way to put it, just because, one, he's playing well at one of the toughest golf courses in the world, and then just what he's gone through. When you're looking at the type of injuries that he's had, which from his car accident, he injured his shin bone, and then he's had injuries down into his foot with multiple broken bones that were even coming through the skin. When we're counseling patients after these types of injuries, it's, at minimum a year-long recovery, potentially longer, let alone to what capability they're able to get to afterwards. And playing at the highest level of golf is, like you were saying, is remarkable in this type of a setting.
Doc, he's clearly a world-class athlete, and he has world-class medical care. For a hack like us... Right, like for somebody like just a normal guy, would anybody like that be able to make a comeback like this, or how much of it is just, he's a really special athlete, I guess?
I think a lot of it's always relative. Definitely, like you're mentioning, his baseline is so much higher than all of ours. But in the grand scheme of things, though, it's I've had numerous folks that have been able to have these types of injuries and get back to playing golf. Is it different? Even when you watch him on the golf course today, you could tell that he had a little bit of a limp. You could tell that he was favoring that. But at the same time, a lot of it comes down to the perseverance, the drive. And, when you're looking at golf, there's a lot of us that go out there, and that's just something we enjoy to do, whether it be the sport, hanging out with buddies. And if you want to go out and do it, and you got the drive to do it, it may be different, but shoot, go after it. Get stuff healed up, but I wouldn't tell you no.
All right, so as this week progresses here, or maybe even tomorrow, if we see, things that we should probably be looking for, hoping that Tiger, if we're wanting him to continue, hoping Tiger doesn't hit the ball on uneven ground, watching for limps early on. If we're noticing tomorrow that he's got a little hitch in his get-along, what are the chances he's able to finish on Sunday?
Well, I think finishing, you know that he's tough as nails, just considering what he's been through before with his knee, his multiple back surgeries. He's just a tough individual, and his competitive level is, his perseverance from a competitive standpoint is, almost 1 to none there. But I think from just as the weekend goes on, when you're looking at the types of injuries that he had specifically, and you're looking at injury around the ankle and down in the foot, as you were mentioning, the uneven ground and just the fatigue, I think, is going to be as big as anything, because one of the larger problems with those types of fractures is just the stiffness that's associated with those joints. And so, yes, he went out there, he played today, which is great. It's going to be the repetitive nature of it, to whether he can come back tomorrow and do the same, and then the same on Saturday and Sunday. And I don't doubt that he's going to be able to push through it. But is it going to get to the pain threshold and bothersomeness enough where it starts affecting his game, which we all know as, lay people out there trying to hack around on the courses, that, when you get tired or you've got an ache and pain, that definitely affects you.
Well, that torque, Dr. Butler, that's what, no matter what injury I've ever had in my life, it seems like an injury to my thumb, somewhere in my hands, anywhere in my arms, anywhere in my knees or lower body, golf is really hard because of all that torque that you're putting on it. And again, when I'm out there, I'm swinging 120 times per round. So it's a lot more than Tiger, but it just seems like any little injury like that can affect your golf game.
Definitely. And it makes you wonder, too, when you look at kind of his injury profile that he's had over the years and all the problems that he's had with his back. And that back problem, a lot of that was associated with the high level of torque that he had for so long. And, we've all seen him swing, and he swings aggressively. And it makes you wonder that if potentially, not saying that there's ever a silver lining to anything, but just that his back problems that he's had to change some of his swing to try to limit some of that torque. And if anything, maybe that's actually helping him now when his lower extremity is injured, where he has to favor that already. He's maybe already compensated to some degree. And once again, we're talking about the elite of the elite that's able to do that. If you or I were out there doing that, it'd be a whole other ballgame.
Right. Dr. Paul Butler from Des Moines Orthopedic Surgeons is joining us, talking about Tiger Woods. One other major injury in the sports world involves the New York Mets. Jacob deGrom going to be out for at least a month. He has a stress reaction in his scapula. Chris, what does that mean?
I know what a stress fracture is.
Yeah, Doc, what's a stress reaction in your scapula?
It's a nice way to say stress fracture.
Oh, okay.
Thing. Yeah, it's the same spectrum of issue, and so when we're talking about stress fractures, stress reactions, they're all kind of rated out as, in the grand scheme of things, like a 1 through 4 scale. And so if you're looking at those on the lower level of that spectrum, you kind of classify them more in the stress reaction, whereas they're higher, they're stress fractures. The difference between them is really how much inflammation is in the bone. And in the grand scheme of things, irregardless of where the injury is, stress reactions, stress fractures, they are annoying and frustrating injuries. Because a lot of times, you look at an x-ray, you can't even see them on x-ray. That's why they were talking about getting another MRI in about a month to reevaluate where he's at. But it's really, you got to shut it down. And the answer is the more you can shut it down, the more you can limit activity, then that gives you the best chance for that inflammation to calm down. And the more that they push the issue, the longer that it's going to be nagging and persist. And so that's why they say, hey, nothing for a month. And then it's literally you go in there, you take another MRI, and, hey, see if it's still significantly inflamed. If they've made some progress, maybe try to start slowly increasing the activity. And if it's still super inflamed, or he throws day one and he hurts, then the answer is shut him down again. And it's the same type of a song and dance when you're working with something in the foot or the leg or any other bone that's got a stress fracture or stress reaction.
That's awesome. Dr. Paul Butler, thank you so much for giving us time today. Greatly appreciate it. This is exactly what we were hoping for. News of the day, and you get to help us dial down in on it. Thank you so much.
Yeah, no problem. You guys have a good one.